Welcome to our overview of nerve blocks. Your surgeon has asked your anesthesiologist to see if you are a candidate for a nerve block. The anesthesiologist is a doctor who specializes in the relief of pain and administering anesthesia for patients having surgery. The purpose of a nerve block is to reduce pain during your recovery, improve physical therapy results, and reduce the amount of strong pain medicine you will need to take after surgery. Strong pain medicines can have side effects like constipation, sleepiness, and nausea. The peripheral nervous system transmits important messages such as pain to the brain. A nerve block can reduce or even take away the pain you may feel by blocking signals from the nerves to the brain. A numbing medication, just like the one used at the dentist office to numb the nerves around your teeth, is used to numb the nerves that go to the body area where you are having surgery. In some surgeries, your surgeon and anesthesiologist may suggest a nerve block catheter instead of just a single injection of numbing medicine. A catheter is a small tube about the size of fishing line. This small tube can be used to slowly drip numbing medicine around a nerve and extend a nerve block's action for up to 3 days. Certain medical conditions may prevent you from being able to get a nerve block, like taking a blood thinner, severe lung disease, allergies to numbing medication, or nerve problems in the body area that you are having surgery on. Please talk to your anesthesiologist if you have any of these problems. In order to have a nerve block catheter, you must also be reachable by phone after you go home, have an adult to help care for you at home 24 hours a day, be able to understand and speak English, and be able to understand simple instructions. Having an adult to help care for you is important because your nerve block may affect your balance and ability to perform activities. The nerve block is usually done right before surgery, but in some cases it may be done after surgery. On the day of your surgery, your anesthesiologist will review your medical history and the type of surgery you are having. They will discuss with you if a single injection nerve block or a nerve block catheter is a good choice for you. It is important to remember that your nerve block is just one piece of your pain management plan. Your surgeon may also prescribe ice, physical therapy, and pain pills. The nerve block is not meant to take away all of your pain, but it will lower the amount of pain you have after surgery. The numbness from a single injection nerve block will wear off over 8 to 24 hours. How long it takes to wear off will depend on the type of numbing medicine your anesthesia doctor has used. Once the nerve block begins to wear off, it can wear off very fast, sometimes as quickly as 30 to 60 minutes. When the nerve block wears off, you may experience strong pain. You may also experience numbness and tingling along with your pain as your nerve block wears off. This is completely normal. Remember, once the nerve block begins to wear off, it can wear off very fast. Pain medicine pills can take up to an hour for you to feel their effects. Therefore, when a nerve block is wearing off and you begin to feel pain, you should take the pain medicine as prescribed by your surgeon. If your surgery was in the morning or early afternoon, your nerve block may wear off in the middle of the night. You may wish to take your pain medications before going to bed to keep you from having too much pain during the night. This video will explain what to expect when you are getting your nerve block. Your anesthesiologist is a doctor who specializes in the relief of pain and administering anesthesia to patients having surgery. A nerve block is a type of anesthesia where the anesthesiologist injects numbing medication around a nerve or nerve bundle, which will block the feeling of pain in part of your body. The nerve block may also cause weakness in the same area. Right before your surgery, your anesthesiologist will discuss the nerve block with you and answer any questions you may have. The nerve block is usually done right before your surgery. It may be performed in a special area or in the operating room. Your team will place monitors to watch your vital signs and give you extra oxygen to breathe during the procedure. Before beginning your nerve block, your anesthesia doctor will go through a safety checklist to confirm the right procedure is being done on the right patient. Once you have been placed in the proper position, your anesthesia doctor will be ready to begin the nerve block. Placing the nerve block will usually take 5 to 15 minutes. It will take longer if your doctor is placing a nerve block catheter. As your doctor begins the procedure, they may give you a small amount of medicine through your IV to help you relax during the procedure. The medicine will not knock you out. It is important for you to be awake during the nerve block so that you can follow any instructions and let the doctor know if you are feeling any pain or discomfort during the process. The next step is for your doctor to clean the area where the block will be placed with an antibacterial soap. Most nerves are just a few inches beneath the skin. Your doctor may use a special machine that uses sound waves to identify the nerve. Once the nerve has been located, the actual nerve block can begin. Your doctor will place a small amount of numbing medicine at the skin. Once your doctor has located the nerve with the ultrasound machine, they will then place a small blunt needle right next to the nerve. Please let your doctor know if you are feeling any discomfort, such as sharp or shooting pain. This will allow your doctor to adjust the location of the needle. Once the needle is properly positioned, the doctor will inject numbing medicine next to the nerve. Please let your doctor know if you are feeling any discomfort during the injection, ringing in your ears, a metal taste in your mouth, feeling dizzy, or anything else unusual. This may be due to problems with the injection. Once the nerve block is finished, many patients may feel the nerve block beginning to work after only a few minutes. It may take up to 45 minutes for the nerve block to reach its maximum effect. You may feel a numbness or tingling sensation or even weakness in the muscles of the body part where the nerve block was placed as it begins to work. Certain surgeries may have strong pain for several days. Because a single injection of numbing medicine with a nerve block only lasts 8 to 24 hours after it is placed, you and your anesthesia doctor may decide that it would be best for you to have a nerve block catheter. A nerve block catheter is a very small tube, about the size of fishing line. It is placed through the needle so that it is next to your nerve. Numbing medicine may be given through the tubing for several days to make your nerve block last longer. Once the nerve block catheter is properly placed, the needle will be removed. Your doctor will use tape and other bandages to hold the catheter in place. They will inject the catheter with numbing medicine and ask you how you are feeling to help them detect any problems with the injection. After the first numbing medicine is injected, your doctor will hook up your catheter to a pump, which can drip a small amount of numbing medicine around the nerves for several days. In this short video, we will go over what to expect after having a nerve block to help reduce your pain. After your surgery, you will be in the recovery area to wake up from anesthesia before going home. It is normal to have less feeling or weakness in the body part where you had surgery. The amount of pain and feeling is different from person to person. Because the numbing medicine in the nerve block may not take away all of your pain, you may need to take pain medicine pills after surgery even though you had a nerve block. When you are ready to go home, you may still have numbness and weakness from your nerve block. How long the nerve block will last is different for each person. Most people begin to have tingling and return of feeling about 8 to 24 hours after the block was performed. Once you are home, make sure you ask for help getting in and out of bed and doing most things. The body part you had surgery on may be weak and hard to control. Do not drive until your nerve block has completely worn off. Also, do not use the body part you had surgery on until the nerve block has completely worn off, unless directed by your surgeon. This is because that body part will not work properly. It is also numb and can be injured without you knowing. Do not apply extra pressure, heat, or cold to the surgical area unless your surgeon says it's okay. Sometimes it is normal for the nerve block to last longer than 24 hours after a single shot of numbing medicine. But it may also be a sign of something more serious. If the numbness is not worn off after 24 hours, please call your anesthesia team and ask for the anesthesia doctor on call so they can help you troubleshoot any problems. If you have a nerve block catheter, The nerve block should wear off within 4 hours of removing the catheter. If the numbness has not worn off after 4 hours, please call your anesthesia doctor. The nerve block is not meant to take away all of your pain, but it will lower the amount of pain you feel after surgery. Do not wait until your nerve block has completely worn off to start taking your pain pills. Once the nerve block begins to wear off, it can wear off within 30 to 60 minutes, and you may feel the onset of strong pain. It may take up to an hour for you to feel the effects of any oral pain medicines. Therefore, when the nerve block begins to wear off and you begin to feel even a small amount of pain, please take your oral pain pills as prescribed by your surgeon. If your surgery was in the morning or early afternoon, your nerve block may wear off in the middle of the night. You may wish to take your pain medications before going to bed to keep you from having too much pain during the night. If you did not receive a nerve block catheter, you should skip the rest of this video. If you received a nerve block catheter for your surgery, then it has already been injected with numbing medication when it was first placed. The catheter is a very small tube. Your anesthesia doctor will connect your nerve block catheter up to a pump that will slowly drip a weak numbing medicine out the end of the tube next to the nerves. These pumps can be used to keep your numbing medicine going for several days. You can even take a pump home to help lower your pain while at home. The pump used in the hospital may look different than the pump you are sent home with. The numbing medicine in the pump is not as strong as the medicine you received when the nerve block catheter was first placed, so it is normal to have more pain, less weakness, and some return of feeling or tingling in the body part where you had surgery 8 to 24 hours after you go home. If you have pain, it is okay to take the pain pills prescribed by your doctor, even though you had a nerve block. Whether you are at home or in the hospital, make sure you ask for help getting in and out of bed and doing most things. The body part you had surgery on may be weak and hard to control because of the nerve block. Do not drive while your nerve block catheter is still in place or you are still numb or weak. You should also keep any sling or any braces on if your nerve block catheter is still in or you are still numb or weak. Your surgeon will tell you when it is safe to remove the sling or any braces you are using. You will have a bandage over the area where the nerve block catheter enters the skin. Do not place this area in water. Try to keep it dry. Make sure to check the area every day without removing the bandage for signs of swelling and redness, which may be a sign of infection. It is normal to have some fluid or blood leak from the site where the nerve block tubing enters the skin. This is usually just some of the numbing medicine leaking out around the tubing. This is normal. Check the tubing to make sure that it looks like it is in the skin and it has not come out by accident. If the catheter looks okay where it enters the skin, do your best to keep the site dry with a towel or gauze to soak up any extra fluid leaking out. If you are not having much pain and you feel the nerve block catheter is making you too numb, you can turn it off by clamping the small clip on the tubing that connects the pump to the catheter. This will stop the numbing medicine from going from the pump to your nerves. It will take a few hours for the nerve block to completely wear off. Make sure you are taking your pain pills as prescribed by your surgeon if you clamp off the nerve block catheter. Otherwise, when the nerve block wears off, you may experience a lot of pain, and this can happen quickly once the nerve block begins to wear off. The catheter should be removed after 3 days, or once the medicine in the pump is used up. It is easy to remove the nerve block catheter tubing from your skin. Before removing the catheter, make sure to wash your hands with soap and water. Gently remove all bandages and any glue around the tubing to expose where it enters the skin. Gently pull the catheter out. The catheter may have been secured to the skin with a sort of glue, so it may stick to the skin, but it should come out easily without using a lot of pulling. If the tubing does not come out easily, or if you feel pain when pulling on it, stop immediately and call the anesthesia doctor on call. Once the catheter is removed, check the tip for a dark marker. If you see the dark mark on the end of the catheter, all of the catheter has been removed. and you can now throw all of the material in the garbage. Never try to remove the tubing by cutting the tubing. This may leave a small piece of the tubing underneath your skin.